Hello, Kim Townsel here. I had not intended to do a part 2 to my Mohs surgery, but when I was uploading the video, I found some files that I forgot to put in the video, so this will be the part 2 of the Mohs on my nose surgery, where I talk about the history for the spot on my nose and the treatment that I used on my nose when I was letting the scar heal up. The original part of this whole thing on my nose was I had like a little brown spot on my nose, and an attorney that I met for dinner one time told me that I needed to stay out of tanning beds and I needed to go have that spot on my nose seen to, and I just kind of poo-pooed it off because I was in tanning beds all the time. I had one actually that I owned in my house and was in and out of it, been in the sun, my whole life. Years later, I went to a dermatologist because it had changed shape a little bit, gotten a little bit larger. And she was not the best dermatologist. I would not recommend anyone to go to her, but she did a biopsy on it, which she cut a huge chunk out of my nose. I had to wear like a big bandage on it when I was going to work for a while, and she came back and told me it was not malignant, that it was nothing to be worried about. So I thought, yay, it's just it's just the ugly spot on my nose or whatever. And then it got to where it became like a little, about the size of an eraser, and it just kept bleeding. Even if I would wash my face, it would bleed, and it wouldn't stop bleeding. I was having to put like a piece of tissue paper on it, and it was really, really kind of ugly. Makeup wouldn't cover it because it never would really kind of dry up. So when I was getting my facials and stuff, the doctor's wife from my skincare place actually was giving me a facial, and she said, you really need to go have that seen about. And she really kind of alarmed me a little bit about it, and had her husband come in and look at it, and they told me I needed to go have it seen about. So it took it a really, really long time to I guess present as something that needed urgent medical care. My skincare specialist at the time, the place that found the spot on my nose and recommended that I go to the surgeon, recommended that I use the product from Skin Medica called Scar Recovery Gel, which I did on the scar once it healed up. I have no idea if it made things better or worse because I didn't cover half of my scar with the product and not do like a test, but it just kind of created a seal on there, and I think that what happens is it holds in like some moisture, keep the incision from drying out, and that's supposed to help it not scar. I still see the scar sometimes if I look for it, but I don't live my life worrying about things that did happen, and I'm just one of those people that thinks scars is just a sign that you survived something. They have a story. If you see something weird, some changes or something like that, even if a doctor tells you that it's okay and you keep thinking that it isn't, then you need to trust your instincts, because I've had a lot of doctors be wrong, and then my instincts were right. And ended up saving my life, and in this case, kind of saved my face. Thank you for watching the video about my Mohs surgery, nose history, and the scar therapy treatment that I used on it. If it's appropriate, please like the video, subscribe to my channel, share the video if you know someone who needs this information. Leave a comment below if you like, and until next time, take care of yourself. If you would like to see part 1 and other videos I have about skin biopsies and cancer, I will try to link those either at the end of this video or in the text below. But they're in a playlist called Cancer.